Thanks, Ashley. Duncan's illness and now death has ignited fear of an Ebola outbreak here in the U.S. News 5's Pat Peterson has community reaction to this public health scare and talks with a local infectious disease specialist to find out what you need to know about Ebola.
A relaxing morning at the park turned into a day of questions and concerns for many when news of Ebola patient Thomas Duncan's death broke in Texas and quickly made its way to the Gulf Coast.
No, that just gives me the chills.
Duncan, who was the first patient diagnosed with Ebola in the U.S., died in isolation at a Dallas hospital this morning. For some, the fact Duncan died on American soil is unnerving.
We're coming to the park and I've got Germ-X, but I know that's not going to help. But still, I mean, it's so frightening. I mean, how long is it going to take before it comes to Baldwin County?
Something we all need to be concerned about. It's here, it's close. It's not that far away. So, yeah, it's frightening.
I'm cautious, but I'm not panicking. We do have a better healthcare system over here.
The patient in Dallas's death is, of course, very saddening, but it is not something that should cause anybody in our local area to be concerned.
Dr. Kimberly Westbrook is an infectious disease specialist at Thomas Hospital. Westbrook says there's no need for folks here to panic.
Anybody who would be at risk would be somebody who would be in the area in Africa, and unless you have traveled to that area, there's no reason for you to be concerned about anything happening here. And patients in other countries don't have the same healthcare system that we have, and our baseline level of health is a lot better.
There is no confirmation and no confirmed cases of patients with Ebola in Alabama. Ebola is not spread through the air, by water, or in general by food.
Governor Robert Bentley talked about the deadly disease at a press conference in Montgomery.
In the event that Ebola spreads to Alabama, we are ready and we are prepared to respond.
Now, most local hospitals are equipped with at least 2 airborne isolation rooms and have emergency plans in place if a patient with Ebola is admitted. All hospitals are right now communicating regularly with the CDC and are using the agency's resources to monitor the situation. Live on the Baldwin County beat, Pat Peterson, News 5.